Kalley-Mae Yee weighed little more than a pound when she was born in 2023. The now vibrant 5-year-old girl from Hawaii Island was recognized as the 2023 Children's Miracle Network Hospital's champion for the Kapi'olani Medical Center for Women and Children. Kalley-Mae and her parents, Kevin and Cherilyn, accepted the honor. They spent an entire year and more sharing Kalley-Mae's courageous story, inspiring countless Children's Miracle Network hospitals, community partners, and supporters committed to the health and well-being of Hawaii's Kiki. And I learned this morning that Kalley just started kindergarten. Accompanying the Yee family is Amanda Price. Amanda serves as the Director of Philanthropy at Hawaii Pacific Health, where she leads efforts to secure funding and support for the organization's healthcare initiatives. With a passion for community health and a strong background in fundraising, Amanda works to build meaningful relationships with donors, partners, and stakeholders. Can you join our organization? Her dedication to the enhancing healthcare access and improving patient outcomes drives her mission to foster a culture of giving and philanthropy within the Hawaii Pacific Health community. Please join me in welcoming Amanda and the Yee family.
Thank you so much for the warm welcome today. We are honored to be here to share more about Kapi'olani Medical Center for Women and Children. Our hospital is truly a place that embodies the spirit of aloha. This extraordinary hospital is more than just a medical facility. It's the heartbeat of pediatric care in the Pacific. Kapi'olani is not just Hawaii's only full-service children's specialty hospital. It's a lifeline to provide critical care regardless of a family's ability to pay. Here, no child is turned away. We serve the entire state and the vast Pacific region, welcoming children and families when they need care the most. Over half of our patients come from uninsured or underinsured families, and yet thanks to the generosity of supporters like you, we can offer them world-class care that they deserve. And as the only level 3 pediatric trauma center, that's really where our partnership begins. So a little bit more about the history of Kapi'olani. How many people in the room are here from Hawaii? Oh, okay, I recognize a few familiar faces. John always comes to visit me at Kapi'olani. Our hospital was founded on philanthropy. In 1890, Queen Kapi'olani was driven by the compassion and her love for the people of Hawaii. She founded the maternity home in response to the heartbreaking rise in infant mortality. She started the hospital with just $8,000 raised from luau's and other community events, truly founded on the culture of philanthropy. From the humble beginnings, we merged with the Kapi'olani Children's Hospital on the property that we are on today. And that building was built in 1976 and continues to expand thanks to generous community partners like you. The Queen's legacy lives on, and we continue that promise of caring for every child in need. So we are uniquely challenged here in Hawaii. We are 2,500 miles from the next nearest specialty hospital. We stand alone in the middle of the Pacific, yet isolated in our mission to provide the best care possible. Our families rely on us because we know that uprooting their families creates a crushing financial burden to travel and also separates them from their loved ones and family support system. It typically takes a population of 4 million people to sustain a children's medical center of Kapi'olani's caliber. Here in Hawaii, we only have 1.4 million, so we rely on our donors and supporters like all of you to make up that gap and fulfill these services for our families. Transport is a critical component of our care. We provide over 500 families with critical care transport each year that need to be transported to Kapi'olani for this life-saving care, for traumatic injuries, and many other causes. Our team goes out to safely transport them, and soon you'll meet one of our families who experienced this service firsthand. A history of support. So the Children's Fund has been supporting Kapi'olani for over 20 years, with a special focus on pediatric trauma care starting in 2012. We take great care in developing proposals each year that impact and save lives of children in Hawaii. Our journey together began with the BURN program. an increased need for specialized burn care, and thanks to the supporters of you, we were able to train our nurses to care for burns of pediatric children, keeping them here in Hawaii. Does anybody know what the #1 cause of burns in children is in Hawaii? I think you're right. So Simon soup, or for those of you who don't know, it's kind of like ramen noodles. That hot soup, if it's pulled off a table or pulled off the stove, can burn a child and on their arms, legs, and their entire body. And those type of injuries on that fragile skin would require the specialized care. And thanks to your support in 2012, we were able to expand that burn care and provide that care for children here at Kapi'olani in our emergency department. In addition to this, we also do a lot of awareness to prevent these injuries in the future. We want to keep our families home where they can heal. We don't want them to be separated or have to miss work and other responsibilities. This was just one of the programs that we were supported, and over the years, we've expanded our efforts to prevent trauma before it happens. From educating caregivers on shaken baby syndrome to ensuring that every child who leaves the hospital in a correctly installed car seat, our community outreach programs reach even those in the most rural areas. In 2019, we shifted our focus to preventing injuries at home, like window falls, which became even more frequent during the COVID-19 pandemic when many families were stuck at home. And in 2021 and 2022, your support expanded care for pediatric traumatic brain injuries to help children on their journey to recover. So the support has really gone from prevention, education, and services to the journey of recovery of a traumatic industry. In 2013, the team expressed the need for firearm safety and water safety. I was really shocked to hear that we needed funds for firearm safety because I didn't think that was something that was a need in our community. But unfortunately, it's a trend that we're seeing nationwide. And thanks to your support, we're able to address this growing need to raise awareness about preventable firearm injuries and deaths in children. Additionally, drowning remains a significant concern in Hawaii, affecting both visitors and residents. We see these headlines all the time in the news, and as a children's hospital, we want to prevent these from happening. We'll have our families wear sorry, I'm skipping ahead. We do a lot of education prevention. Our families are given these water watcher cards that go around the risk, and that really is to identify the responsible adult who's watching the kids. They shouldn't be on their phone, they shouldn't be on the pool, have a drink in their hands. They really need to dedicate 100% attention to their children. So that's just one of the ways that we eliminate distractions. The other photo is of our life jacket safety station at our recent Cancer Center camp. So really trying to prevent these injuries before they happen, especially because drowning is the silent killer. We want to be able to watch the children and keep them safe. Your generosity makes these life-saving programs possible. This year's grant will enable us to continue our injury prevention program, providing full-time prevention services and reaching rural communities statewide. The impact of your support will touch thousands of lives and prevent countless children from entering our emergency room or even worse. We are all here today because of the incredible families that we serve, like Ms. Kalley-Mae, the dedication and encourage these families to continue our mission. I'm honored to introduce Callie and her family today. They drove over from Hilo, making the long drive. Over the past few years, we've had the great opportunity to get to know the Yees as Callie served as our Children's Miracle Network champion. If you went to any store in Hawaii, Walmart, Costco, Safeway, you would see Callie's picture. They've really just been incredible ambassadors for us, and we're lucky to call them our family and friends. Please join me in watching their story. Are you going to just tell the whole story?
I met Kevin back in 1998, and he was a baseball player, he coached kids, and he was great with kids. And for me, I just wanted to do whatever I could physically to give him a child, knowing that he would be such a great father. We did go through the IVF process to get pregnant. Kalley-Mae was actually our 5th try. We did have 2 prior losses, one at 19 weeks and twins at 21 weeks.
We took her pregnancy when she was pregnant with Callie pretty much day by day. But, with it in the back of our minds, knowing that, at any time, something or complications could happen or something could go wrong.
Kalley-Mae's journey actually began even before Kalley-Mae was born. Her mother had been in Hilo, and so she was emergently flown over to Kapi'olani. 23 weeks it's very early in the pregnancy. The risk of death is very high. And sometimes even despite our best efforts at 23 weeks, the babies are not developed enough. When Callie was delivered, those first moments when I saw her and just how small and fragile she was born 1 pound, 6.6 ounces, 11.81 inches long, so just short of a ruler.
We're just looking at each other, and I just kept saying, is she okay? Is she okay? At that point, I didn't even care if she had 10 fingers or 10 toes. It was just, is she alive?
I remember clearly and just how critical she was, where Kalley-Mae was on the ventilator, barely could breathe on her own. So we require only 21% oxygen, and this little itty bitty preemie was requiring 100% full support.
It wasn't where you give birth and the baby comes on your chest and you're able to, kiss your baby or anything. For us, we basically had to look at her through the plastic isolate for several weeks before we were actually able to touch her.
The very first day that I took care of Kalley-Mae was the day that she was scheduled for open heart surgery. I heard about her before she was even born because her mother and I have exactly the same names.
And people weren't sure who had the baby, if we were related.
I had nurses from all over the hospital thinking that initially I was her mom.
Callie's heart surgery was the first time we met her, and it was, oh, you're the other Cherilyn Yee. Even after the surgery, every day was touch and go.
There were periods where we thought that she might not make it. She very nearly died on more than one occasion.
Kalley-Mae had been on a lot of respiratory support, so she needed to get some movement and exercises and a little bit of stretching. As she got stronger and a little bit older, we were able to do a little tummy time on the mat.
I think Kapi'olani is the true epitome of a power team. They have all of the different pieces, the equipment, the specialists, to give total care to all of their patients.
When it came time to actually go home, they called it graduation day because, you're graduating from the NICU.
I came in on my day off. I could not miss that day. To see them go home, it's like, wow, we did good, but ultimately it's really, they did good.
Just by looking at her, you would not know she was born at 23 weeks. She is a bundle of joy. She's a firecracker. She's the true meaning of a champion.
Seeing Kalley-Mae today and seeing how doing and what her odds were to start is enough. How much of a difference it makes to us to have this Miracle Network we get from to have support get possible for us to sometimes pull our hat, make it possible for some of these kids to survive.
We just wanted to say, thank you to Children's Miracle Network, to all of the donors, to the sponsors, volunteers. We are truly grateful and forever in your debt.
Hi, Kalley-Mae.
do you like to play?
T-ball.
And what else?
FA soccer.
And
Basketball.
and
Volleyball. Thank you for helping kids like me.
Well, as you can see, she's a normal 5-year-old now. But 5 years ago, we didn't know if we would be at this point in her life. And, thank you to all of you who do fundraise and help out programs like the hospital. It is possible that we get to share this life with Kalley-Mae. And, with everything that we've been through, we don't see and understand all the behind the scenes people like you folks and everything that you folks do. So from the bottom of our hearts, we thank you guys.
what do you want to say?
Thank you for helping me.
Yeah? And thank you for helping all the other kids like me.
Thank you for helping all the other kids like me. And thank you for raising a lot of money for Children's Miracle Network.
We just want to thank you from the bottom of our hearts for your commitment to Hawaii's keiki, like Kalley-Mae and the Yee Ohana. So please, everything that you do, every dollar that you fundraise truly makes a difference. I heard Jennifer mention earlier about the monthly donations. It's such an easy way to give, so I encourage you to do that and to make it easy for yourselves. But thank you for all of us. On behalf of Kapi'olani Medical Center, we extend our gratitude.
Thank you, Amanda, Kevin, and Cheryl, for Kalley-Mae and Kalley-Mae. If you could stay on the stage with us for a moment. You're already there. Friends, if you haven't heard the news, your generosity this year enabled the Cal-Nev-Ha Children's Fund to award more than $128,000 in grants to our partner hospitals. Since 1994, we've awarded more than $2.2 million to our partner hospitals. The CNH Children's Fund has made an incredible impact on supporting the pediatric trauma program at Kapi'olani. Since 2004, your generosity has provided life-saving child energy prevention and provided seed funding for trauma and injury prevention programs to grow and support children throughout the state of Hawaii. Kapi'olani will use this year's grant to expand the Kiki Injury Prevention Program by 400 hours a year to allow Kapi'olani to increase services statewide. The Cal-Nev-Ha Children's Fund is thrilled to partner with Kapi'olani to prevent children from needlessly suffering from unintentional injury. Thank you for sharing with us this morning and sharing your story. And thank you for collaborating with us to build a better future for children. I want to say, folks, this is what your donations do. We can't save them all, but we saved this one. I ask that you join me in making a gift this morning. Scroll back down here. You went beyond this. Crips. Backwards. Go back to the dollar presentation. Go back to page 46. We're not going there. Okay. It's my pleasure to present this check to you for your grant this year.
Thank you so much. Thank you for helping kids like Callie.
Can I just get off? Why are we gonna get off the stage?
Yeah, we can go off the stage now.
Get off this thing now.
And I have to thank Hilding because normally this TV up here doesn't have the camera on it, so she was able to dance in front of the camera. I think that might be a future thing we can do. It would lighten things up a little bit to have the speakers sort of dance in front of the camera while they speak. That's a great idea. I'm gonna have to work on that one. If you want to provide our student leaderships with more leadership training opportunities, if you want to increase the number of scholarships awarded each year, or if you believe every child should have a happy, a healthy, and safe environment in which to live, then pick up your phone and scan the QR code on the back of your breakfast program. Every gift, regardless of the amount, makes an impact in a child's life. Together, we can build a better future for children. You may notice we're using a new donation platform called Zephy, which is 100% free to the CNH Children's Fund, which means 100% of your gift this morning goes to our programs. Now, you may also notice a suggested fee added to your gift. This is how Zephy makes their platform free to nonprofits. But know that this is only a suggested amount. You can change. So I hope you join me this morning in saying yes to youth by making a gift to the foundation. This is my last opportunity to speak to you as the president of the Children's Fund. I'm going to be off script for a minute. I've thought a lot about what I wanted to say. I don't like standing behind podiums, but that's where I have to be right now. I am so grateful to each one of you for what you've done, for your contributions to the children in the Cal-Nev-Ha district. I've visited the hospitals. I've seen the NICUs. I've had the privilege of seeing the work that you do, seeing the fruits of the work that you do. I've attended our leadership training courses. I've been to Key Leader. I've had the honor of giving away scholarships to students who, but for your generosity, would not be going to college. And so I really want you to understand when you hear numbers about what we've done this year, the last 2 years being the best 2 years that we've ever had in fundraising and gifts back to our clubs and our district. I really want you to understand that what you do, honestly, sincerely, matters. And that's always been what I've said to you, and all the times I've talked to you, what you do matters. This is not a game we're playing. We're having fun, and we're having fellowship, and we're doing everything that we can to be good Kiwanians, but at the same time, what we're doing is making a difference. What we're doing is helping children like Kalley-Mae. What we're doing is literally saving lives all over our district every single day. So I want to thank you for that. I want to thank you from the bottom of my heart for everything you're doing for your foundation. I want to thank you for the grant applications that you got money from your foundation to use and put back into your communities to make a difference specifically in your community to meet a need. I want to thank you for doing that because that's what this foundation is about. That's what we're here for. So please continue to support us. Please continue forward on to make us even better so the next 2 years are even bigger than the last 2 years. As I told you in my report to you, we set a goal of $1 million. Thanks to your generosity after that, we're now at $916 million, which is $3,000 more than we were yesterday. We only need $84,000. Can anyone write me a check for $84,000? Okay, I accept that. Can anybody write me a good check for $84,000? One that won't bounce. But it's each one of you working and giving a little donation, what you can, that gets us to this point. And you're the ones that have accomplished that. So I want to thank you. I want to thank you again to our sponsors, Denise and Ranson Ganji and Merrill Lynch. Thank you, Governor Carroll and Governor-elect Doug. Thank you, President Katrina. Thank you, President-elect Designate Michael. Thank you all for being here this morning, and most importantly, for your support of your CNH Children's Fund. Your generosity ensures the CNH Children's Fund continues to grow and to thrive. This concludes our honors breakfast.